How do you start CF enzyme therapy for infants? Starting pancreatic enzyme replacement therapy for infants with cystic fibrosis is a vital step in helping them grow and develop healthily. Cystic fibrosis often causes the pancreas to produce fewer digestive enzymes, leading to difficulty digesting fats, proteins, and carbohydrates. This can cause poor weight gain, greasy stools, and stomach discomfort. Enzyme therapy helps infants absorb nutrients better, supporting their growth and overall health. The first step is confirming the diagnosis of cystic fibrosis and pancreatic insufficiency. This is usually done through newborn screening tests, sweat tests, and clinical evaluations by healthcare providers. Once the diagnosis is confirmed, the healthcare team will recommend starting enzyme therapy as soon as possible, often within the first few weeks of life. The typical starting dose for infants is between 2,000 and 5,000 lipase units per feeding. This dose is given with every feeding, whether it is breast milk, formula, or solid foods as the baby grows. The exact amount depends on the infant's weight, feeding type, and how they respond. The goal is to help the baby gain weight normally and reduce symptoms like greasy stools or stomach pain. Dosing usually begins at the lower end of the recommended range and can be increased gradually if needed. The healthcare team will monitor the infant's growth, stool patterns, and overall response to therapy. Adjustments are made based on how well the baby is growing and whether symptoms improve. Regular follow-up visits are essential to ensure the therapy remains effective and safe. In some cases, acid suppression medications like proton pump inhibitors or histamine 2 blockers may be prescribed. These medicines help reduce stomach acid, making the enzymes work more effectively. This is especially helpful in infants with cystic fibrosis, as stomach acid can interfere with enzyme activity. Parents and caregivers are taught how to administer the enzymes properly. Usually, this involves opening the capsule and mixing the enzyme powder with a small amount of acidic food, such as applesauce, to protect the enzymes from stomach acid. The mixture is given just before or during the feeding to maximize absorption. Ongoing communication with a cystic fibrosis care team is crucial. They will regularly check the infant's growth, adjust enzyme doses as needed, and address any concerns. The main aim is to support the infant's nutrition, promote healthy growth, and improve quality of life. Always remember, each baby is unique, so personalized medical guidance is essential for optimal care.